me what you see when you look at me. Do you see another brother lost in these streets looking for his soul?
Trying to find my soul.
Or do you see another brother searching for lost souls in these streets? A street soldier.
Street soldier.
Here to help you get that chip off your shoulder, warm your colder days and sober your drunken ways, and find a way to help you get over these hurdles placed in our path. And this is not meant to amuse you. This is for all those who have questions but are afraid to ask.
I won't be afraid. I won't be afraid. No. When times get hard, you lose your way. Open your mind and hear what I say.
This is a message for the hard and the soft. To those who tune in weekly and to those who keep an eye out for 8 p.m. on Sundays and turn their radios off. The truth hurts. The cloth has been pulled. We're walking around half dead. Use this show as your IV. Alive and free is a new movement. We've achieved self-destruction. A street soldier promotes self-improvement.
Streets couldn't be no colder, so I gotta be a soldier. It shouldn't be this hard for me. Even when it seems so hopeless, I gotta keep my focus. I'm glad to be alive and free, yeah. Streets couldn't be no colder, so I gotta be a soldier. It shouldn't be this hard for me. Even when it seems so hopeless, I gotta keep my focus. I'm glad to be alive and free, yeah.
All right, Dr. Campbell.
Dr. Campbell.
We've been doing
Hey guys, how you doing?
A month and a half now. Schedules hit and miss. I haven't, you didn't yet, but we got you now. Thank you once again. Glad to see you, Doc. How you doing, first of all?
I'm doing fine, thank you. I'm hanging in there, trying to adjust to all the changes that we're going through now, like everybody else is. It's been kind of weird. I mean, for 2 years, I was going to meetings on Zoom like we're on right now. And all of a sudden they said, well, we want you to come in person. So I've been doing a little bit more traveling than I really want to do and going places where I wasn't sure about, but I have to go. So I just, I'm just getting used to it like everybody else is. I'm a bit weird to be in a large group of people and you don't really know, what their vaccination status is. Usually people are triply vaccinated, so it's probably okay with that. So the risk is a little different. But on the plane, this day I was on the plane, I posted something on my Twitter thing about the guy sitting next to me sniffling and his mask. I told him to put the mask up, and he would keep it down. It was like 4 hours, so I said, all right, I have one N95 on, so I put on two N95s, and the whole time I said, you can make a choice to sniffling and doing your thing. I can make the choice where I put this on and try to protect myself. And of course, as soon as I walk in the door, the wife says, you better take the COVID test.
Absolutely.
I mean, it's like I've been traveling so much, so it's like I had 3 or 4 in the last week. So it's like, thank God they've been negative, but this is the new world. You go someplace and you got to make sure you protect your family, and this is kind of bizarre now. You gotta, because it's still out there. I mean, we'll talk about a lot of different things, but last week there was a gridiron dinner in Washington D.C. and it was a super spread event. There were 68 people got sick from COVID, so it's still out there, and it's still people are trying to get back to doing things normally. But there's risks that you take when you go out and things, and you have to figure out what your risk is. And I'm getting lined up to take my second booster. So
let me ask you about the plane. I've gone once. I went to Seattle. It wasn't a long flight. Everybody was masked.
Yep.
This gentleman next to you, he just didn't wear a mask.
He had a mask on, but he's like sitting there and he's like this with the thing down below his mouth, and I was just like, come on.
He didn't have it on then.
Yeah, he was like, I said, so then put it up, and then it came down on his nose, and I was like, so I think this was 6 seconds I took off the mask to take a drink of water because I was getting dehydrated.
Well, boy, yeah, and that underscores everything, right? And it's funny, when we first talked about you coming on the show, I got this article. I think the date of this article, what was that? This article is April, maybe it was April 1st. Anyway, and I wanted to start here because I looked at it and I said, I got to get Doc on. He said, this is from CNN Health. The end is near. The new pandemic data looks promising for some anyway. And then it began with, while the pandemic is not over, experts say the US may be in for, at the very least, a near normal spring and summer based on US Centers for Disease Control and Prevention data. And then it gives a lot of stats about COVID levels dropping and large swaths of the country. The metrics, there's a significantly lower risk you get sick from COVID-19. And then the second half of the article is the surge is ending, but. So let's not go to the but right now. Let's start with how are things? Do we want to go straight to the but? Because
so we're, I guess we'll start with we're 2 years in, coming on 3. It probably, if you thought it started in the end of 2019, so we're kind of between the 2 and 3 year mark. It was March 2 years ago that we all went on lockdown and shut everything down, and things were looking bleak. We didn't know how transmitted. People were washing their groceries, and they weren't exactly sure what to do, and masks weren't readily available. So we're in a much better space. There's a lot fewer cases, fewer people dying. I mean, I think on the last 7 days, maybe 500 people been dying a day. So we're about at somewhere like 80 million cases, 984,000 deaths across the country. And there's about 30,000 cases, but that's probably an undercount because people are getting tested like I was doing at home, and nobody's calling in to get it done. You don't have to go in and get yourself tested because the testing is readily available. They count on you to if you're positive, basically to self-isolate, take care of yourself, make sure your family's okay with doing things. But the good thing is that they've disconnected the disease numbers from the numbers of people in the hospital, because there's a lot less people in the hospital now. At one point, we had 70, and the number is we just have a couple now at San Francisco General. So it's not that bad from what it was. There's not any huge number of new cases now.
Let's talk about
Okay.
Let's talk about the remarkable progress, because we know it's silly, we know we have to be cautious, but the progress has just been unbelievable. I mean, and I think it's important to talk about that, because this was something that was completely unknown, came out of nowhere, was totally mishandled by who, right? So, I mean,
he whose name we won't say.
It's Chinese. It's it's a damn, but the progress, I just think it's one of the great medical stories in the history of mankind. I mean, and I think it's important to talk about that, how this progress has been made to get from where it was in the beginning to the peak, or to where we are now. So just, I know and everybody's heard it, but just say it again. And as a medical man, I just think it's, especially since
I think the first thing is that we're in a much better place than we were. Think about this: at the beginning, people were dying. We didn't know why. Everybody was like paranoid. Nobody wanted to go out. We were all in lockdown. They shut everything down. It was a bit of a terrible thing. Then we started understanding how to get the testing. When testing got better, testing was more widespread. And then that was the alpha wave. Then things got better. And then next big wave was the Delta wave, and that came through. And then the Omicron wave came through, and actually it was way worse than the others, because there were up to 1 million people getting infected a day. The Omicron wave was pretty terrible. And now there's an XE variant that's there, and there'll be in other variants. The thing that is interesting, and we don't know if it's going to duplicate itself, in England and Europe, they're having some problems. In Shanghai and China and Hong Kong, they're having problems. And they're usually a little bit ahead of us in terms of having problems, but we're going to have to play it by ear and see what happens. Right now, we're about 65% people having 2 vaccines, about 30 to 35% of people having 3 vaccines, and the 4th vaccine just became available for people over 50. If people who are immune suppressed can get it, and you can get either one. You can either get your Pfizer or you can get Moderna, depending on what you had. I mean, I had 3 Pfizers. I'm thinking about mixing and matches. Other people may get another Pfizer and see what happens. And that's safe to do. And so the virus is what it is. The vaccine is very effective against making sure you don't get severe disease. So that is a really great thing. It is doing its job. And the problem is it wears out over time. And they say over a month or 2 after your second booster, it starts kind of going down. So that's why we're gonna have to be taken. Eventually, we're gonna go to the annual shots, like much like the flu vaccine. But right now, because it's still coming out, you have to look at the other big problem that we have. So that's just the United States. Worldwide, we're not nearly where we need to be. There's about 3 billion people who have not been vaccinated. So this is a worldwide pandemic. And until we can take care of people, the rest of the world, I mean, the last stats I saw is something like 15% of people on the continent, 58 countries in Africa or so have not been vaccinated. So that is not really good numbers. That doesn't bode well for us because another variant can then develop because people are unvaccinated. But we're better off than we were. People are starting to do normal things again. I mean, I went to a Warriors game, even though I did wear my mask when I was there. Most people were unmasked.
Mm-hmm.
And
yeah, it's a sort of those current guidelines. I just don't want to leave yet the whole story of the development of vaccines. I mean, had that ever happened that fast in history? I'm really into history now because I'm watching this whole thing, a history show, History of Africa. But in what, a year, in 2 years, they developed a vaccine. And one of the things you clarified, because I know we had questions about the speed of the vaccine being developed, but apparently they have been working on something like this.
Yeah, 3 to 5 years ago, they started working on a coronavirus vaccine, and they started doing amazing things. So they knew it was sort of coming soon because this is SARS-CoV-2, there was SARS-CoV-1, and there'll probably be SARS-CoV-3 over the years. So these are things that they kind of knew was coming. And what they're working on now, and they haven't got close to this, is something that will vaccinate you against all the SARS-CoV vaccines and viruses we have. The good thing is that if you're vaccinated, something like the people who are unvaccinated now, and there's actually a fair number of people. I've been traveling a little bit and I'm talking to people, and people will just tell me the weirdest things. They're like, well, there's not enough information. I'm like, well, we have 150 million people vaccinated, right? Maybe, more than that now. And there hasn't been any major problems with it. They're like, well, I don't want to put that in my arm. I wouldn't be caught dead having it done. And I was like, well, you probably have 10 vaccinations already. And you didn't tell me that, okay, your mother said, don't give me that polio vaccine because I want to get polio, right? Don't give me that measles vaccine because I want to get measles, right? Now, those of us who are old enough had measles and chickenpox and all that stuff, but people don't get that anymore because they've been vaccinated from it. But there's sophisticated people who have not taken the vaccine. I'm talking about educated people, even some physicians and nurses, which is, you would think that they would want to lead the way in providing a good example about taking the vaccine. So there is some vaccine hesitancy still that's out there. And it just boggles my mind when you have something that is so treatable. Now, the other people will say this, is that if you get the virus, you get the infection, I'm going to be immune from that if you're infected. And you're going to have some immunity from just getting the infection itself. But the problem with getting the infection is a couple things, is that first you get the infection and you're sick. You're about 48 more times higher rate of dying than if you're unvaccinated. If you're vaccinated, so if you're unvaccinated, 48 times chance of dying if you are vaccinated. So great protection with the vaccine. The other thing is that there's this entity called long COVID that we've talked about here before, and about 30% of people will get some sort of long COVID. Long COVID means you're persistently fatigued, you may have muscle aches, you have brain fog, you may have some cardiac problems. I mean, even it's been associated with, in small cases, of people being impotent associated with that. So, men having sexual dysfunction. So that there's a lot of different things that it's been associated, with getting. And if you take the vaccine, your chances are a lot less of getting into trouble related to that. So, and I think that we got to keep saying the messages. The vaccines are safe. They work. They were developed over 3 to 5 years, and maybe it's faster than other vaccines were developed. But we've been working on it for a long time because we knew it was coming, and because of that, it's been safe. Now, if you've given it to 200 million people, and there hasn't been any major problem, and it hasn't been any major problems, you would see that people would be dropping dead. I've had people tell me, well, there are people dropping dead from the vaccine, and they're not telling you that. And I'm like, really? I mean, it's like, yesterday, people got, in Iowa City, 10 people were shot and 2 people were killed. I mean, you hear about that stuff like all the time in terms of violence. I mean, there would be a massive upheaval if large numbers of people were dying from the getting vaccinated. People still do die from getting COVID, but if you're vaccinated, you may get it. There's a chance, but your intensity of the infection is less. Your chances of getting long COVID is better, and your recovery is better if you are not immune suppressed. The people who still have problems are the immune suppressed people because they don't mount enough antibody response to the vaccine. So what happens, the vaccine sort of triggers your body to sort of say this protein is coming, so you get the infection. And if you're immune suppressed, right, then your chances of getting a serious infection is real, and being immune compromised and getting a really bad infection.
We have cited, and well, we should, smallpox and all the vaccines that we took in the past willingly and were mandated. I've often wondered, and of course it's not easy to wonder, that if those diseases were here, if that happened now, because I still don't know what happened to make this one different than those. If in fact there would have been either the freedom pushback, the government pushback, whatever pushback there is here now, and as individual as the person, if in fact we would not have been able to vaccinate people against those. I mean, smallpox was a killer and is a killer. I mean, what would have happened if that had happened in the 21st century? I still don't know what happened with the science thing. I don't know what happened.
If you got these terrible looking lesions from smallpox that you got if you got COVID, right? I mean, I don't think there would be a thing, because you get these terrible blisters, you get bad respiratory problems, and you die from smallpox. That's why there was such a push to eradicate it. I mean, even I was just listening to a historical talk, and even back in the times of the Revolutionary War, they figured out that if you got exposed to some of the vesicle particles on your skin, and you got it would trigger an immune response. So Washington, our first president, was trying to vaccinate his troops against smallpox because it was so bad. And this is a long time ago. This is at the beginning of the creation of the United States, where they recognized that this was a problem. And then over time, it got much more sophisticated to the point where now you get a shot and it goes away. So
I actually don't think, and this is hard, and this is me being the pessimist here, because the way they've treated the approach to this vaccine, the COVID vaccine, I don't think they would have been able to do that with smallpox, measles, or anything. And it's fascinating to me. It's fascinating to me because they work in lives. But
think about this. If we had Ebola here, Ebola is this terrible thing where you basically get it and you basically bleed out of every orifice and you just bleed to death and you die. And it's terribly infectious. It's way more infectious than COVID. Imagine the Ebola outbreak in the United States. It was Liberia, and because of good sense of the public health folks, they were able to control it. And maybe there was just a couple cases that came to the United States. They were able to isolate them. But if there was a true Ebola infection, right, it would be terrifying. This was scary enough as it is. But if we had an outbreak of something like that in the United States, and we had the poor leadership that we had at the very beginning, I mean, if there was the folks in charge could have come out and said, listen, this thing is serious. Take the vaccine. It does work. And, much like what President Biden has done now, but if past President Trump would have done that, then,
he would have said was an African disease. So he would have, that's the first thing he would have said.
But that's the problem. It was not affecting them. And at the very beginning, they've done a lot of studies, and we talked a lot about how it affected people of color, African Americans, Latinos, Native Americans, and we were dying 2 to 3 times more than anybody else. And a lot of things I think has to do with the fact that a lot of folks of color were in service industries. So if you're in service industries, you got to go to work. If you work driving a bus or driving a train in New York City where people are getting sick and dying from, or police force or whatever, and you're a person of color, that's why people were dying from the thing, because they had to actually go out to work and do things. And if you're a person of color, you got to go to work. It's very different than someone that could stay home and telecommute and do things by Zoom, or do your stuff by email and what have you. So it was quite different for people of color than it was for the majority population. But it's very economic. So if you were someone who was white and had to go to work, you were at risk for infection also. But it just so happened that it affected people of color more at the very beginning than now. Then it sort of then spread. And the last wave, it was basically all the red states were just getting wiped out. I mean, it was pretty terrible. I mean, it's bad that anybody dies from this thing, but if it North Dakota, South Dakota, Mississippi, Alabama, I mean, it was just terrifying how things were going. Those people were just like, I'm not vaccinated, and they could recover and they don't want to get vaccinated.
I know. They would go to the hospital and say, and react to it. So yeah, jump in. I'm sorry. You want to get
How
in?
you doing, Dr.
I'm sorry, go
Campbell?
ahead. Hey, how are you?
I'm well, sir. Wanted to ask a question and get your perspective or your thoughts.
No problem.
Here in the Bay Area, I'm sure the rest of you have been noticing a lot of the mask mandates have come down, and I knew they were, but it's still different now. I'm inside places and I look over and the next person isn't wearing a mask. And now that number is picking up. There's still some people, and I still wear mine, though if I'm honest, I'm tempted to take mine off sometimes too. Just because when you see other people not wearing it, it's just like a subconscious thing in your head. You're like, ooh, I don't need this. And people are just tired of it. I know that Dr. Marshall, you don't like that phrase, but
No, there people are tired of it.
there's always been some people who
It ain't
deny
about being
COVID,
tired,
right?
it's about necessary, but go ahead. Finish.
Yeah, I mean, there's from the beginning, there's people who are in denial.
Yep.
I would guess that as time goes on, that number will grow more. People are either they're in denial, either they're over it, they don't care anymore. And so I'm saying all that to set up my question. Outside of vaccines, are there any other things from a public health perspective that can be done to slow down another wave? And that's not saying, we don't get vaccinated. I'm just wondering if there's any other public health measures that can be put in place outside of vaccines.
Well, this is all the classic stuff. Thanks for that question. It's very classic. It's, hand washing, the social distancing. I think this is in San Francisco, we're 90% vaccinated. So we're in actually a pretty good spot. I don't know what the boosted percentage is, but I think it's north of the national average. I don't know exactly what that, now nationally I know it's 35%. I don't know what the third vaccine is number here, but I know 90% of people are vaccinated. So in general, if you're outside, it's probably safe that you don't have to wear a mask because there's, the wind is blowing and it is not that dangerous to be outside wearing a mask. The problem is that if you're inside and you don't know what the status is of the people around you, then that's when you have to think about what is your risk tolerance, right? With that, fully vaccinated to me means you get two shots and a booster, so 3 shots, not 2. So that is the first thing. If you have 3 shots, then you got to figure out, well, what's your risk, or what's your age, what's your comorbidities? Are you willing to take the risk of doing stuff? I told you when I was at the game here, I mean, there were 20,000 people there. And yeah, I may have looked like a fool with my mask on, but I don't care. I took it off when I'm eating, when I'm drinking something or eating something, I took it off, but I put it back on when I was with people because I don't really know what the vaccination status is. I'm doing things, but outside it's probably safe not to wear a mask in general if you're outside. If there's a big crowd around you, then that's a little bit, I was in Washington and they had the Cherry Blossom Festival last week, and there were thousands of people outside. So when I was by myself, I felt pretty good about it. But with 300 or 400 people around me, I just feel a bit weirded out, and I would kind of put it on, and then I take it off when I'm by myself, or there's less people and it's safer. And you just have to figure out what your risk tolerance is, for that. I mean, I wanted to strangle that guy sitting next to me who was coughing and sneezing, because I was just like, man, this is too much, right? I'm like, this is too much, because I'm forced to be around him, and there's not a lot of space. I'm sitting in the middle seat, in the exit row, and I'm like, we're right on top of each other. So I don't like that situation, right, at all, because that, they're trying to get the airlines to stop using the masking policy. But I think in the short term, you can't do that yet until we're through. We see there's going to be another wave of this, the BA2 or the XE or whatever it is before you do that. And you got to really be careful, with some of it. But it's all about, what they did is, instead of mandating it now like they had before, except for planes and in taxis, they basically now put the risk on you, like what's your risk tolerance for exposure to the virus. And if you're vaccinated, you're in pretty good shape. If you're outside, if you're inside, you gotta what's your risk tolerance for doing it? Are you feeling like okay about doing it? So that's really what they were trying to do. I think when I get boosted, I'll feel a little bit better, right? The second time, because I've already been boosted once, and then I'll feel a little bit better about stuff. But there are things I'm doing now that I wouldn't do. I wouldn't go to a meeting. Like last year, they banned all travel at the University of California. You said you couldn't go anywhere. And then in August, they basically started lifting up. But there's been meetings now where people go into where 10 people, 15 people out of maybe 1,000 got infected. So that is really happening still, where people are getting affected. So it's not over. It's still out there. You're still at risk, and you got to figure out what your risk tolerance is for getting exposure to the virus. Because there are people, even when they were checking vaccine cards, there were fake vaccine cards. Because I don't think anybody. Why would you make that up?
That should be a crime.
I'm like, why would you make that up, right? Just get a damn vaccine. Take
fake vaccine.
Get a real card, with that. But I know that people feel weird about wearing masks, but I don't really care. I said, you look at me funny, I don't care. I'm just, you can do whatever you want to do, but this is just my decision for me, and just, stay away from me. That's.
Let me ask about the, and the soul disappeared. I wanted to see if he got his answer. Let me ask about you talked about this a little bit, the second booster.
Yep.
And I got 4 or 5 articles about the second booster, but I've just got them ready for you. They're recommended for people over, let's see.
Over 50.
Over 50.
Over 50 right now.
Do I really need a booster? The answer depends on age, risk, and timing. For people over 50. So I guess
if you're over 50, you should.
Because I am.
Get a second booster. If you're immune suppressed, you should definitely get it. So those are two big. Immune suppressed over 50. If you have chronic illness, you should definitely get it. And I would think if you have chronic illness, if you're younger, you should probably get it also.
Yeah, it talks about extra protection. Let's see. But the evidence, there's a quote here said that 6 months out from my first booster, the evidence of that booster begins to go down. Another dose is the benefits are real. In fact, what quote did I write here? The older you get, the bigger the benefit. The older you get, the bigger the benefit of the second booster. So yeah, where can you get? Can you get it anywhere and everywhere? I mean, before they organized, people organizing. Can you just walk into Kaiser? Can you walk into your health center? How do you get the second booster?
Yeah, they're even, I think, giving it now at Rite Aid and Walgreens. So it is available.
Okay.
I just scheduled mine for Kaiser.
Yeah, Kaiser, they'll do it. They'll do it with you.
Do it? Okay.
And, I'm probably going to get it at San Francisco General where they're giving it out. I got a thing saying sign up to get your second booster. And that's kind of where it is. So you can go to your own doctor and get the booster there if you like. So it is a lot more available than it used to be. It used to be kind of rare, hard to get, but now it's easier to get.
I talked to a couple people who've had it, and they said the less effect of any of the shots. I mean, this person had nothing. The arm hurt a little bit, but it was nothing like the Moderna 1, Moderna 2, or the Pfizer 1, Pfizer 2, and nothing like the first booster. So I mean, not that it would matter to me. I'm getting everything, but yeah. So okay.
I just got a sore arm, but some people had different. We talked about this before. That Mrs. Stowe got, felt wiped out when she got the second one, and other people had, felt wiped out too. But to me, that just means your immune system is working, right? So I wish I would have gotten wiped out, but I just felt like I just got a sore arm. I'm just like, just knocked me out, just knocked me on my back, give me a fever, make me feel like I got something. I just got my damn sore arm. That's all I got. I'm like. No, because it just means your immune system is turned on. That's all.
I did. I had a follow up, and I'm sorry I missed it. You probably already addressed it, but I'm going to ask since you're right here.
No problem. I'm happy.
Fully vaccinated as of a few months ago. How long is that going to last?
So you're fully vaccinated to you. What is fully vaccinated? We got to have this right definition. Fully vaccinated to you means 2 or 3.
I had first Johnson & Johnson.
Yep.
Which I thought counted for 2. So I think of that, however you want to break that down. And then I, for my booster a couple months after I had COVID. So yes, I also had COVID, but I got the Moderna boost, and that's been a couple months.
So you Johnson & Johnson, and then you got.
Then I got COVID.
Then you got
down
COVID.
for 2 weeks. Then I had to wait, and then I got the Moderna boost.
And how long ago was that?
That was about 2 months ago.
Yeah, so usually it says that it's about 4 months after the last dose that you have it. And you look like, I'll just say, I'll give you a benefit of that. You look like you're younger than 50.
Looks can be deceiving, sir.
Looks okay. So
he's
they say the 3 to 4 month window, your immunity wanes. So if you want to get it, I would just go out and get it. The fact you had COVID gives you some immunity, but the fact that you've had one booster already, that is actually really good. But I think the second booster, pretty much we got to get more people to get it. So I would recommend getting it as soon as you can, when it's readily available to your age.
Is that what the future? I'm going to be getting a booster every 6 months?
No, I think what will happen is once everything's settled down and it sort of becomes endemic, because right now it is still, everybody debates, is it pandemic, is it endemic? Endemic means that it's just background and it's not a lot of people getting sick from it, and it's not creating a major stress on the healthcare system. Pandemic means that it creates a stress on the system. You got to shut the hospitals down. You got to get ready for the mass humanity coming and that kind of stuff. You got to go into emergency planning and disaster planning. And once it gets to that point, there'll probably be once a year you'll have to get it. Kind of like the flu vaccine. Once things settle down. I mean, it's not totally settled down yet because we're still having these little outbreaks here and there, or whether or not it's at a medical convention or it's at the Gridiron dinner last week
in DC.
Or in the White House. They're having an outbreak in the White House right now where people are getting it, and Nancy Pelosi got it, Barack Obama got it. I mean, that he had to be totally boosted, unbelievably boosted, and he got it too. So these are people who have the highest level of health care, and they're still getting it. So you have to, and I'm sure he was vaccinated and boosted, and he still got it, but I bet you he was out reading people, because that's what you do as a politician, and he got it.
Thank you.
Can you talk a little about this BA2 variant? What's that pops up in my news things as I, as soon as I saw what I said, oh, the end is near, and then they said, oh, but so that was
the virus is very smart, and it's always mutating. So there's an alpha, then it kind of goes through, and then you have delta, then you have Omicron, and then the Omicron the BA2 is a version of Omicron that has different these spike proteins on it than the previous version. And then this XE2 is another variant of interest that they're trying to following right now. And there'll be another one. We'll go through the whole Greek alphabet, with these things and maybe start over again with that. And the problem is the vaccine is always mutating. And as it mutates, then it looks differently, and then they got to test to see whether or not the vaccines you're getting are effective against it. The BA2 is just a different variant of the Omicron that they recognized, and it looks different than the first Omicron. But they think the BA2 is more infectious, and so instead of it, Omicron, the first variant of Omicron was very infectious. This one is 4 to 8 times more infectious too. So that's why it takes less time for you to get exposed to it, for you to get the thing.
Well, it is the state of it. I mean, it says here it's the dominant variant in the U.S. right now, but there haven't been a lot of infections, or what are
Yeah, but right now, in terms of the classic numbers that we have, there's about 30,000 cases or so of people who have been getting infected a day over the 7-day average, and 13,000 a day in the last couple of days. So it is, the numbers are level. That's just the numbers that we have now. People, as I said a little bit earlier, people are not reporting the home test. Like, I took a home test, and if it was positive, you're supposed to report. I was just reading this thing today where they were like, well, people aren't really reporting the fact that they have the home test and what the home test results are if it's positive. So we're going to have to play this thing by ear, because we're going to have to see if people will begin to report it, and they'll be able to tell us that they're positive.
How has just again, you've been battling this thing. It's 2 years. Wow. It seems like it's been forever, but 2 years. Is the climate changed, or how do you feel about the climate in the country and the people when it comes to battling this thing, or dealing with this thing?
You mean climate means people's attitude, or climate mean the climate on the planet? What do you?
Oh, no, people's attitude. No.
So
people's attitude.
I think Malcolm was saying it a little bit earlier. People are just like, they're tired of it. I mean, I'm tired of it too. I mean, sitting on a plane. I mean, I was coming back from the East Coast, and I had the mask on for about 8 hours total, and it was. I'm a surgeon. I wear a mask all the time. I have my usual. I got this mask. This is an N95 respirator. I got this mask here. I got other masks. Or maybe I took it out. Yeah. But I got them. I got surgical masks over here. These are my surgical masks, right? So I got. I'm just trying to be as ready as I can be. When I travel, I got multiple of these things. So I'll just pull it out and I use it. Yeah, I'm tired of wearing that too, and dealing with stuff. And I gotta say, I was given a lecture for actually 900 people 2 weeks ago, and it creeped out a little bit. I gotta say that honestly. I mean, there's a lot of people in there. But then I got up, I took off my mask, I gave my lecture, and I put the mask back on. Now, there's 900 medical people who were there. But when I was sitting in the audience, I had my mask on, and it's like, and I was in Las Vegas. I mean, there are places you go in the United States right now where the pandemic does not exist.
Right. It's
really kind of weird. So I'm walking through the casino, right, in Las Vegas, going to my room, and there's thousands of people, and nobody has a mask on at all. And I'm like, I'm the odd one out. I got mine on, and I'm doing my thing. You get in the cab, you got to wear it. In the airport, you got to wear it, but the rest of the time, nobody has it on. And general outside, you're okay and you're safe to do it. But you walk in and there are people smoking, and it's just and it's just a mess there, and people aren't paying attention to it. In Los Angeles, it was a little bit lax down there. Even though they had a lot worse cases than we had up here. I mean, that's where the main deaths happened in California. We had somewhere, I don't know, we had about in California, so we have 89,000 deaths. We had 9.3 million cases, 9.1 million cases. in California, and most of the deaths we had here, 30, 40,000 were from Southern California.
What?
I spent about 6 weeks in Fort Worth, Texas.
Yep.
They act like there's no such thing as a pandemic either.
That's right.
You go in the grocery store and it's about 50 people in there. 5 of them have on masks. I have on a mask. And I also noticed that people are so friendly now. Everybody wants to talk.
That's right.
You know, this has been the friendliest time. I mean, everybody's gonna say, "Hey, how are you?" I'm like, why you want to be friendly now? The people have not been friendly, and all of a sudden, I have had more people wanting to have a conversation up close. Anyway,
It is a weird time because people, I have to say, you know, when I go to the meetings, I mean, there's a lot of people I haven't seen for 3 years, and I would see them
yeah,
a year at a meeting nationally or even internationally. And I hadn't seen them, and people they just want to come. I went to this meeting, this is interesting, in Washington, D.C., and they had these lanyards, and I don't have my lanyard here from the thing. So lanyard thing you hang your ID on. So there were 3 types of lanyards, right? One was a red lanyard, which means don't come close to me because
right.
6 foot thing, right? And then there's a yellow lanyard. Well, I'm uncertain, you know, we could do it if it's up to me and I want to control things. And there's a green one. You can hug and high five and
Right.
Wow. That's
how it was. I went to
Delta people had the green
convention.
thing on, but I'm still kind of yellow, almost red. My wife, she was shocked that I didn't have a red one on because I'm like, but you know, I'm kind of like in between. You know, this is a doctor convention. There's mainly doctors there, but I'm sitting in an audience. I got my mask on, and if I got to get up and speak, I'll take it off and put it back on, and you know, I will wear it. You know, when I'm eating, I take it off. When I'm not eating, I put it back on. So I'm trying to exercise some caution with the new change. But there's certainly places in Florida. I mean, we went to Florida last year, and they were like, "Oh, the pandemic went on for 3 months here, and then it was over." Right? And
and somebody said to me, "It's over. It's over." That's what
the
it
weirdest.
is. Over.
It's the weirdest thing. It's like, "Oh, we've been over for a year." I said, "Well, the whole rest of the country's not over it yet." And you know, people didn't have masks on. They were like, you know, like, "What do you got to wear a mask?" You know, what's going on? And I think you have to, wherever you go, you have to understand like what your risk is associated with stuff. So, you know, when I was outside in Florida, I was probably okay, and then the beach, at the pool, it's probably okay. You know, but when you go inside, you know, I would sort of be cautious where people are sitting, that kind of stuff. And you know, outside of the bar, it's probably okay when you're drinking something outside, and it's not gonna be a big deal when you're outside. But it is.
You want to say something about
I have a question about symptoms.
Okay.
I'm wondering over time if the symptoms of COVID are consistent, or are they changing? Are they looking a little different now that we're in the second year of this?
So my understanding is the symptoms are the same. It's like you feel like you have a bad cold. Other than the thing that's different now with COVID is that you start losing your taste to things, and that's really when you know you have it. Is that your taste, but you can't taste the food you're eating. You can't taste, you know, if you have an ice cream, you can't really taste it. The flavors in the food are not there, and you know, you'll have headache, muscle aches, respiratory problems, because it's actually it's a multi-organ infection. The thing that's the most scary, and there's so many things that are scary, is the blood clots that you get when you have it. So a lot of people develop blood clots all over their body, and this is not regular flu. This is something that's really you don't want to get. And they're like, "Oh, I'll get it and I'll be okay." It's like, no, they're young people get it and they died. And that's.
How do you know if you have a blood clot?
Well, you have to go to a doctor and they got a
right
diagnosis, right? So if your leg swells, if you got the infection, leg swells up, right?
Okay.
Breath, or you have chest pain, you know, the clot could be in your lung, it could be in your leg, it could be in your brain. Actually, one of my relatives had a clot in her brain from the COVID. It is. It's quite. It is not. This is not anything to be joking about. It's quite serious. You know, people have from it. I mean, she had a clot in one of the veins in her brain, and she's a fairly young woman also. So it's these are things that are really scary.
Yeah.
What have you heard about the schools? I haven't heard a lot about schools. I don't know if they're functioning fairly well in spite of, you know, what have you heard, Doc? You heard anything about schools?
About the schools,
Yeah.
yeah. At least in San Francisco, when they opened up things, people were pretty cautious about wearing masks and all that stuff. And now, I'm not sure kind of what it is. I think it's up to the parents. The last I heard, it's up to the parents to see whether or not the kid. So if you're 5 and up, you can get vaccinated. If you're vaccinated, you're probably okay. But if you're under 5, then you can't get vaccinated yet. They've done studies, they're looking at things. It turns out that for the really young, the vaccine, Pfizer works pretty good, but the 3 to 5, they're still trying to work on getting the dose together. And once they get the dose together, they'll be able to liberalize it and have more people get vaccinated. Because if you can vaccinate all the kids, then it would not be an issue, with it. But there's not been any big outbreaks.
Yeah, I heard, right.
Talked about. There are places around the country that they've had outbreaks and they've had to close the school now. And that,
Right.
in the states and the counties and the cities where there are lower vaccination rates, there has been episodes of that within the last few months. So that does so happen. Somebody gets tested positive, they then there's a full stop. They keep the kids home. They make sure the kids get tested.
Yeah.
But the thing that's scary, I mean, I just had a dinner with someone who was a teacher in the DC school systems. And this is something that, I know as you guys are all educators, and so am I, that they feel that, and she's a 4th grade teacher, she feels that all the kids are way behind because at least a year or 2 behind their reading level.
Oh, yeah. We've heard a lot of that. Yeah.
Oh, this is a real, that's the big thing that's going to have a huge effect on this generation of kids.
Yeah.
Business of not being to date with their assignments, and their 4th grade, they're reading on the 1st or 2nd grade level. This is a really big. It's not. This is not going to be something that is going to go away. There's going to be a lot of remedial things that need to be done for kids to catch up, particularly the special needs kids. They're gonna be behind because they, imagine. I mean, it's hard enough for us to stay on. I stay on sometimes all day, and it's just torture. And I'm just, it's just unpleasant. If, you're on to your 8th, 9th, 10th hour Zoom. It's hard, right? and think about what it is if you're a kid and you're on Zoom and you're a teacher trying to teach on Zoom. How do you capture them? I mean, even when I teach classes on Zoom to the medical students, I got to make sure they're listening to me, that they turn the videos on. I got to ask them each question so they know that they're awake, right? And that way I know that they're plugged in. Because you can sit there with your video off and not even pay attention to what I'm saying. But I'll
be miles away.
We know that very well.
If you have your video off, I'm calling you more than once, right? And that's until you turn the video on, right?
Well, Lady has it down to a science. She knows how to handle off camera and all of that stuff. I think they're all really scared of her, so they don't do. They don't play that. They no.
You have to make sure that the year before the pandemic, I was in charge of the 3rd year education curriculum for all the medical students at 10 hospitals. And we started doing things online and teaching on Zoom. And then we had a combined hybrid thing. Some would be in the room with me and some would be on Zoom. So I got used to teaching on Zoom. And what you have to do is you have to engage everybody, the whole group. And with the group, then you can be successful. If you don't engage the group, then you can't just take care of the people who are in the room with you, and you can't just focus on the people who are on the Zoom. Also, you have to be really flexible in the way you teach when you're teaching on Zoom.
How? I guess and I don't know if you have any questions in the chat, but for me, how are things looking with the world? I mean, everybody takes care of their own. Everybody pays attention to their own. But like you say, this is a worldwide disease. I'm assuming the term is developed, nations or that made more progress with this than others. But when I hear it's like 15% on the continent of Africa, so on and so forth, because we're all connected, right? We're all connected. Just like this war has got us all connected, right? Um, I know have they made an effort? And again, I'm in my head is they just went and vaccinated everybody when we had smallpox. We're going over there and we're gonna take care of everybody. Where does that stand? Do you know much about that? Where does that stand? The effort to trying to vaccinate?
This is what I know. I know that we've given away more vaccines than any other country in the world. I know that. There's a tropical medicine doctor named Peter Hotez, Dr. Hotez. He's at Baylor College of Medicine. His group actually created a vaccine that's free of charge or very low cost. And he's now engaged in his own project where they're trying to vaccinate as many people as possible with the cost vaccine. And he's had some great success, but we have to be more vigilant about doing it all over the world.
Yeah.
That I think we'll do it. The thing I worry about this, everybody's focused on what's going on in Ukraine. Now, what Ukraine is, what's going on there is just terrible, and it's just so scary and unbelievable. And I know we see it, all day, every day, and it's just terrible for, I actually didn't know a lot of things about the Ukraine. I have Ukrainian patients at the hospital. When I was in New York, I had Ukrainian patients, and they're pretty tough people. And there are 45 million people in that country. It is actually the biggest country in Europe, and they have wheat there, and I mean, it was a high functioning place. I mean, overall, until now they're getting all blown up and getting killed, and it's so. But the thing I worry about, just get back to COVID again, is that the vaccination rate there is very low, and that is because there's a lot of pushback, and because people are leaving and they're not wearing masks because they're running for their lives. They're just trying to survive these terrible things that are happening. I worry that there may be an outbreak there in Eastern Europe that will be kind of scary. That I hope that we can. Yeah. So I hope that cooler heads will prevail and they'll sign an agreement and they'll stop this. But talk about rebuilding our country, and this whole thing is ridiculous. That's what's going on over there. I mean, it has all these things. I mean, there's. Vladimir Putin is talking about denazifying the country of Ukraine, and of course, Vladimir Zelensky, the president, is Jewish, and he has a Jewish family. Plus, he speaks Russian, and he's from Eastern Ukraine, right next to Russia. So that's where his family's at, and it's just kind of unbelievable, this whole thing. But from a COVID perspective, that may be another hotspot as we sort of. They have 3 million refugees in Poland, and there's all kinds of ethical issues about the whole refugee question here and refugee question there, and so forth, related to race and so forth. But it is the vaccine. I hope that in addition to getting cared for and taken in, that people get vaccinated, and that does not lead to any increase of infections in people, because it's bad enough they're going to have PTSD because they're getting bombed every night, or people getting shot, or their families getting killed in front of them, and that's just a god awful, terrible thing that's going on there. But I hope that that there is no rise in the infection because of what's going on over there now.
Oh, well said. Well said. Okay, I've gotten all mine, and you've gotten all of yours, Lady E. The April 10th, 2022, your best take for folks on this virus. What should they be doing? It's just tell them.
The first thing I would say is that it is not over. It is with us. Everybody's tired, and I'm tired like you are, and everyone else is. But you have to be vigilant. Vigilance. Take your own measure of your risk when you're going someplace where everybody's vaccinated. It's probably going to be okay. They're vaccinated and boosted. So to me, fully vaccinated is 3 shots, and soon will be 4 shots. So not just 2, it's 3, and it'll be 4 soon. So you got to make sure you get 3 shots now, and when you can, get the 4th booster. With that, be careful when you're going to big indoor gatherings, and you don't know what the vaccine status is of people, and if you adjust your risk tolerance based on your age, based on how healthy you are, and whether or not you have any comorbidities. These are all things that you need to make sure as you begin to take care of yourself, then take care of your family. This is what you have to do. Because I always worry about I've been testing, regularly when I'm doing things that may be high risk, and just to make sure that I don't expose anybody in my family to it. And I would say the federal government finally sent free tests to everybody. And if you get a hold of them, get a hold of them. If you feel sick, stay home. Don't expose people to things. Just be cautious as we go forward, because it's not over and it may come back again. I would not be surprised that if the incidence goes up again in the hospitals. Right now, the incidence of infection is detached a little bit from what's going on in the hospitals, and that's good. That means that people aren't flooding the hospitals, flooding the ICUs here in the United States right now. But that may change, and we have to keep an eye on what's going on in China, in Shanghai. I mean, they had this thing yesterday where people were screaming and yelling because they've been on lockdown for 7 or 8 days in Shanghai, and they got millions of people on lockdown in China right now. And Hong Kong's the same thing. Europe, they've had outbreaks of things, and we usually lag behind them. So I would keep an eye out for that. Make sure that you're safe and you're cautious when you do things, and just follow the rules. You're on a plane, wear a mask. In a taxi, wear a mask, and just ride it out until we can figure out whether or not we're going to get exposed to this. Is there going to be a next wave? The whole Omicron thing just sort of came out of nowhere. We're just going from Delta, and all of a sudden Omicron is a dominant thing, and now BA2 is dominant, and this XE may be dominant, because each one of the virus mutations are much more infectious than the one before, and people will be getting it. I mean, if the Speaker of the House, the third most powerful person in the country, has it now, the first gentleman, he got it, former President Obama, he got it, and you just hear more and more people. The Secretary of Agriculture got it, and now the mayor of New York has it, that's the latest thing as of today. So people are getting it, and I think that you got to respect this thing. You can't let your guard down. You got to be careful, because it's when we let our guard down, that's when things happen. And people are starving for real interaction. That people want to go away. People want to do things. And I think I've gone away and done things. I went to Hawaii, and going to Hawaii was a whole trip. Right? You had to go and do the safe travel thing and get a ban for it. They had to make sure you were triply vaccinated. They don't make you get a test anymore, but there's still places where you go to where you have to have a negative test when you come back in the United States within 24 hours of PCR. So you have to, if you're traveling, make sure you know the rules are for traveling if you're going abroad and doing that, because you can't be stuck. I mean, I was invited to do some speaking in Salzburg, Austria in December, and they were in the middle of Omicron, and there was a big outbreak. They didn't cancel the thing till the week before, and it was a little bit creepy, even thinking about it. But I was just like, okay, if I went there, I got infected, and I can't get back in the United States, and I wouldn't be back for Christmas.
Right.
So you have to gauge that. So they canceled it, and it became a Zoom thing, and I did a Zoom thing with people from all over the world on Zoom, and I gave them my lecture on Zoom, and that's. In fact, I thought all these things I've been doing recently, the last few weeks, where I've been traveling a little bit more than I want to, is because I thought it was going to be on Zoom, and I can sit in my office, turn on my Zoom thing, and I can give my lecture, and everything is fine, and it's exciting, and it's fine, and I don't got an issue. But the problem is that that's not how it is. People are like, oh, we like to see in person in our place, right? So I just left Chicago yesterday and came back, and now I'm going to Chicago on Tuesday to give a lecture there, and I'm going back there. So it's like I'm getting on the bus going to Chicago.
Take all your masks. Follow all the rules.
Got to follow the rules. Do what I have to do. Wear the mask. When I'm
once again, just thank you for everything. Thank you for your
thank you for having me.
Update. It's better. It's better.
It is much better than it was, and
we got a long way to go.
I think we gotta celebrate and be thankful for that. We're in a much better space. Things are better, and people aren't just dying all over the place. And think about this: at the very beginning in New York, I mean, if you were in New York and you lived there, you'd be hearing sirens 24/7 of people collapsing at home and dying. I mean, that's like, and there's nothing like that going on right now, right? Anyway, and it's way better.
And that's what this guy told me. It's over, but he's silly anyways. It's over. I said, man, it ain't over. Okay.
It ain't
Thank you very much, man. Thank you very much, Doc. I'll let you go.
great to see you guys, and thank you for having me on. And let me know when you want me to come on again. If hopefully
All right.
it'll be
Stay
going.
alive, free, and COVID free. All right.
Thank you, Dr. Campbell. You take care.
We'll see
No
you.
problem. Good to see you, Anna, lady and stuff. Good to see you guys, and take care now.
Take care.
Bye.
Good night.
Good night.